Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. Thank you and welcome to our weekend community fertility clinic. Today is the second day of December and December is already upon us. I hope you're getting ready to end your December with style. I hope you've been able to accomplish all your set goals. I hope you've been able to look back and say you've done your best. You still have about 29 days to get it correctly. Now, today's topic is a very unusual topic, but a topic that deserves comprehensive address. Now, there are so many women out there who, for some reasons, they have not been able to start their family. These are amazing women, loving women, caring women, hardworking women, professionally oriented entrepreneurs, business owners, well accomplished, but they have not accomplished and they have not realized one particular goal, one particular dream, something they've always wanted to have. They have not been able to start their families. People are in different phases of life when it comes to relationship. So these women are women that wanted to have babies. I remember growing up, I knew exactly the number of babies I wanted to have. But when I eventually met my wife, we have to look at our objectives, we have to look at our realities, and at the end of the day, we decided to have 2 kids. Now, tomorrow we might decide to have more. So there are some people out there, genuine women, loving women, amazing women, but it's possible that right now, they might not have that relationship they are looking for. They might not have a husband, they might not have a boyfriend, they might not have a fiancé, but they want to start their family. And when they look at their age, realistically, as a woman, you are wired as a biological clock. So as a woman, by the time you get to age 35, there are so many changes that will happen in your body to affect your fertility. So the question I'm going to address today is, can a single woman who genuinely want to be a mother, can she have her own kids? What are the options open for her? What advice can I give her? How can she realize this? Is it really possible to have your own kids by yourself, without a husband, without a suitor, without a boyfriend, without a partner? The answer is yes. Now, you need to understand that this topic is not a moral instruction class. I'm not here to litigate your religion, to know whether you're a Christian, you're a Muslim. I'm not here to litigate that. I'm only here to address a singular topic of the possibility of a single lady who obviously is in her late 30s, in her 40s, in her 50s, even in the 60s, wanting to have her own babies. We need to understand that people are wired differently. We need to understand that what we might not like, some people might like. So we are from different extractions, and our organization subserves everybody. So I know some people will come in strongly with, oh, you need to marry to get this together. That's not what I'm here for. I'm here to guide you, to give you the rudiments, to give you the basics. And I'm here to tell you, yes, you can be a mother. You can have your babies as a single woman. But you need to know your options. You need to know your reality. As an adult, this is your choice, is your decision. So this is 2023, going to 2024. Your life is your life. Your choices are your choices. Most of us, we do stuff because our parents told us to do that, because we grew up with that particular belief, with that particular practice. I'm a Christian. I didn't have babies outside marriage. That's what I believe. But there are some people that are not Christians. They do what they want to do. The same thing is also applicable to single women. So I don't want you to go into depression. I don't want you to go into anxiety. I don't want you to, withdraw yourself from the society because you wanted to have a baby and you couldn't have a baby, and the society, the culture where you live, your family, your mom, your dad, everybody's hipping on you and you feel like you're a failure. You are not a failure. Having a baby, marrying, or doing whatever is not a criteria for success. I hope you understand that. The fact you're married, the fact you have a baby, the fact you have this and have that does not define your success. You define your success. Whatever you call success will be your success. So I'm here to encourage you, and I'm going to take your hand, and I'm going to give you the options available for you. Now, it's left for you to practice them. But I want to say this. If you genuinely want to be a mother, especially if you're above age 35, at age 35, let me tell you what's going on. Let me tell you why we're having this conversation. Every woman in our community today, God gave you 2 ovaries. Inside is your 2 ovaries. You will come into this world with complete sets of the eggs you will use to start your family. When you come of age, which we call reproductive phase of your life, every month you will release 1 egg. As you release that egg, if that egg is not fertilized, you're not going to get them back. So over time, the quantity and the quality of your eggs will reduce, especially when you get to age 35. We will notice a sharp decline in the quantity and quality. So your fertility begins to decline sharply at age 35. So if you're in this community right now, you're 36, you are 40, you are 45, you are 50, you are 60, and you want to have your babies, yes, you can have your babies. The question is how? And that's what I'm going to teach you today. Number 1, the first baseline we have to run for you is to check your fertility index. So as a woman, if you have not gone for your well-woman check, you have to go to a gynecologist. We have to collect your blood to check your reproductive hormones. We have to check your tubes. We have to check the womb. So we have to do the baseline for you to see where you stand. But above all, we have to check your ovarian reserve. So we collect your blood and we check your anti-Mullerian hormone. That will determine what you're going to do next. Now, there are 2 options left for you. If you want to preserve your fertility for later, assuming the husband you're hoping for doesn't come and you're in your 45 or you're going to your 50s, you can begin the journey of using whatever preservation you had in the past, and you can have your baby. If you also want to have your baby right now, I will also give you that option. So to start with the first one, you can preserve your fertility. So preserving your fertility will actually work better if you are in your late 20s. Preserving your fertility means we're going to check that everything is okay. Then we carefully and through careful procedure, go and harvest your eggs and freeze them. The best time to freeze your eggs are in your late 20s. So the older you begin to freeze your eggs, the more the eggs are going to be poor quality. So if you're in this category, you're a career woman, you're in a professional discipline, like if you're a doctor. Doctors are in perpetual study and education till they die. So there are some professions you will get into before you blink. You won't even remember you have relationships. You won't even remember that you wanted to have babies. So you have to multitask. So you can preserve your fertility. So we can save all your eggs when you're 27. And probably if you get to 35 and you still don't have a partner, by the time you get to 40, you can piggyback to those eggs you saved when you were 25, and you can use it to start your family. That's for preservation purposes. So you can comfortably preserve your fertility in your late 20s, in your mid-30s, up to your 40s, then you can begin to use them even when you're in your 50s. That's number 1 criteria on how you can have your own baby as a single woman. It's possible. Number 2, we're not talking about things you can do right now to have those babies. You can go for, with your consent and with good understanding with your close friend, your close male friend, both of you can have an agreement and your friend can donate the sperm. It's called natural donation of sperm. It's called DIY, do it yourself. So if you have a matured, educated, agreeable friend who is obviously healthy, who doesn't go about messing, doing lifestyle nonsense, both of you can come to understanding. Both of you can sign legal agreement, and your partner will donate his sperm. That your friend, I'm not calling him a partner, a friend, a matured friend, will donate his sperm to you based on the fact that everything is going okay with you, you have your ovulation and all that. That donated sperm can get you pregnant, and you can have your baby. And it will be an agreement between you and your friend that when the baby is born, the baby will be solely yours. Now, if you live in some locations, it's expected that when a particular baby that came through sperm donation gets to age 18, It's the duty of the mother to tell the baby that that baby has a right to know who the donor sperm is. So that's number one. So you can approach your friend, both of you can have mutual agreement. Now, how you end up doing this sperm donation is up to you. Some close friends can actually make love. So your close friend can get you pregnant. Your boyfriend can get you pregnant. Your fiancé can get you pregnant, despite the fact you guys have not done the legal thing. Now, remember why I'm saying this. I'm not here for anybody to say, hey, Dr. Chudi, this and that. I'm only telling you based on wherever you're coming from. So you can do it yourself with your partner. Now, beyond doing it yourself, you can also go for fertility expert approach. So once we confirm that your eggs are good, the other option left for you is to work with who? A fertility expert. A fertility expert can use different approaches. We can use IUI, artificial insemination. So in artificial insemination, we confirm you're producing your eggs. If you're not producing your eggs, we can give you ovulation induction drugs. Then we look for another donor sperm. So what's the difference between the donor sperm I mentioned earlier and this one? In this donor sperm, a fertility specialist will look for quality client candidate that will give a sperm. In this case, you don't need to know who that person is. So we're going to use the sperm. We're going to introduce the sperm into your womb. And when the sperm gets to the womb, the sperm can begin the journey to go and fertilize the egg. That's number one option. You can also go for IVF. In IVF, we're going to bring your eggs out. We're going to bring the sperm out. We're going to join them together. Then we put it back into your body. Now, if you prefer a particular gender, despite the fact you're single, you can also go for intracytoplasmic sperm injection, an advanced form of IVF. So in summary, you can be a single lady, single, responsible, matured, caring, loving mother wannabe. If you know that when you go down 6 feet, you will have regrets of the babies you didn't have, yes, you can have your babies. You can have it by yourself, you can preserve your fertility, or you can go to a fertility specialist. Depending on what is obtainable in your location, it is possible to have your own baby. If you want to have your baby, you can have your baby. So if you're in a relationship right now, boy-girl relationship, and you've looked at your odds, you know that your biological clock is winding down. Both of you can have an agreement. You are two adults. Once a baby is conceived, that baby is a sacred gift from God. God loves all his babies. So it's your choice. Now, some other people, based on religious belief, will want to be single and don't have a baby until they go into menopause and they can do whatever they want to do. It's your choice. I just want you to understand the choice component. But I'm telling you, as a single lady, you have these options I've given you. You can preserve your fertility, or you can go through the steps I've given you, intrauterine insemination, IVF, or ISCI, to have your own baby. Now, there are other advanced approaches. So you can actually stay back at home by yourself and you can get yourself pregnant without the penis entering the vagina. So there are some advanced tools you can actually use to personally inseminate yourself with a friend or whoever you had an agreement with, and you can still become pregnant. What leads to pregnancy is still going to be the same original thing. There are only 2 ways you can become pregnant. Natural ways: the penis will go into the vagina, the penis will ejaculate, the sperm will go to the tubes, hoping that the eggs are there, the sperm will get the egg fertilized. If that's not available, you go for fertility specialist, for fertility assistants, IUI, IVF, and ISCI. These are the only ways you can become pregnant. So if you are single right now in this clinic, and you know you genuinely want to have a baby, maybe you had a fiancé, it didn't work out. Maybe you had a long-term boyfriend and he disappointed you. Maybe you've been spending a lot of time making money, building your career. Maybe you recently got divorced or you got separated, but you know you want to be a mother. You can be a mother. Now, together with that, you can also go for surrogacy and you can also adopt, depending on what's obtainable in where you live. Like in this part of the world, in America and other developed countries, you can do whatever you want to do. At the end of the day, whatever makes you happy is what you will do. I will not personally want you to have any regrets. Life is not all about regrets. Life is about lessons. So don't spend the rest of your later age, especially when you cross 40. 40 is a remarkable period in your milestone. When you cross 40, you are on the other end. You should be planning for retirement. So don't tend towards 40, 50, when you should have someone that will call you a mother, someone that will love you the way you are, and you'll start living your life in regrets. And you will start using the resources you have. Maybe your mom mocked you, maybe your siblings mocked you, maybe the church mocked you, but they will still come to you for the money. Am I making sense? Am I talking to somebody? I don't know if I'm talking to somebody. If you're that person, I want you to connect with me. Don't live your life in regrets. If you know you want a baby, if you know you're a good mother, a caring mother, but right now in your reality, despite the fact you're praying to God, despite you're born again, despite you're a Christian, despite you've done everything, but you know within yourself genuinely, and you're looking at time, and time is not in your favor, take your actions based on your choices. You can. There is this joy you feel when you connect with your own. So think about the options I've given you. Don't go into depression. Don't die a depressed woman. Don't die lonely. Don't die sad, because most of us go into things to please our parents. Most of us don't go into certain things to please our parents, but we have to put ourselves first. When you say no, you are saying no because you want to say no. When you say yes, you are saying yes because you want to say yes. When you're in a toxic relationship, you leave that toxic relationship because it's not serving you, not because to please your mother or your father, because eventually your mother and your father will die. That's a fact. Eventually, all the village people, eventually all the elders, they will all die, and it will come to your turn, and eventually you're going to die. That's a fact. So if you know having a baby is going to make you happy, then please think about that. Take a moment and think about that. If you have a matured relationship, laden boyfriend or a good friend, both of you can agree you can do this. Then you can seek help from a fertility specialist, and they will give you various criteria for that. But please, let it be a well-laid plan, and you can execute it the way you want to execute it. And I'm promising you, you are going to be happy. Remember the caveat? I'm not standing here as a Christian, a Muslim, or someone that don't believe in God. I'm only standing here as a maternal and child health specialist. And I'm giving you this advice strictly on professional perspective. If you want to go for it, go for it. Knowing fully well that when you go into menopause, you no longer have a chance. So you might eventually marry. You might eventually see someone later, and by then you will not have that natural opportunity. When you get there and you don't have natural opportunity, you also have to step up your game and you go for your IUI or IVF. So here's the deal. If you're a Christian or a Muslim and is really, really against your religion, then this topic is not for you. But if you know as a single lady, you have been seeking this, you have been waiting for someone that will come in and say, hey, it's possible, I'm the one you're looking for. So go for it, okay? Right now, I'm going to open the clinic and I'm going to give you an opportunity to ask your questions. So please start asking your questions. Just so you know, starting from this December, my YouTube clinics is going to be only on Saturdays. So Saturdays, 12:30 p.m., you're definitely going to see me. We're going to talk about topics that affect our community. So show up every 12:30 p.m. Saturdays moving forward. Make sure you click on the notification. Make sure you subscribe. So moving forward from today, in our bigger umbrella SGHS family, I'm going to also mention a couple of changes. Starting from today, our clinics are going to be 2 clinics on weekends. So 1 clinic on YouTube on Saturday. Tomorrow we have another clinic on Facebook. Then Wednesday we have another clinic. So a total of 3 clinics for me. And we'll still definitely have our masterclass. We actually have 3 events for December. A free masterclass coming up on the 6th by the special grace of God. That's next weekend. Then a masterclass, our last paid masterclass coming up on the 17th. Then 31st December is our crossover clinic. So plan ahead. But right now, please start asking your questions. How can one get surrogate in Nigeria? You use the resources there. You go to your gynecologist, you go to your fertility specialist. There are some agencies that offer surrogacy. The best place to seek that information is through your gynecologist or your fertility specialist. For example, if you're in Lagos, our fertility expert, Dr. Odega in Lagos, can help to facilitate setting you up with an agency that can help you with surrogacy. I'm sure you understand the concept of surrogacy. In surrogacy, for some reasons, you are not able to have your own babies. Maybe because of some medical problems, disorder in your womb or whatever in your body, and your body is not able to retain the pregnancy, to carry the pregnancy to term. So we're going to look for another woman who is called a surrogate, who will now be the person that will bear your baby. That particular method is out there. You will still be called a mother. So if that's your option, unfortunately, there are some women, as I'm talking to you right now, their body will not be able to, carry pregnancy and carry it to term. That's the next best option for you. Surrogacy and adoption, okay? Ask your questions, please. For a young lady who is in her 20s and having watery discharge from her breast, what could be the cause? Now you need to know the differentials. So differentials in medical practice is the likely things. So first things first, if anybody out here as a woman is not pregnant, you're not breastfeeding, and you notice that anything is coming out from your breast, that particular condition is called galactorrhea. Galactorrhea. Now, one of the things that can lead to this is the fact that your prolactin level might be high. So the baseline investigation we have to do for you first is to go to your gynecologist, we collect your blood, and we check the level of your prolactin. If thankfully the reason why you're having galactorrhea, which is the discharge of milk discharge or clear discharge from your breast, is because your prolactin level is high, we're going to give you appropriate medication that will bring your prolactin level down and it will stop. Now, you need to understand that when you're not pregnant and you're breastfeeding and your breast milk is coming out and the prolactin level is high, is a cause of infertility. So it means that when your prolactin level is high, possibility you're going to ovulate is low, so it will lead to infertility. Thankfully, it's a type of infertility we can address. Once you've had 2 miscarriages, at that particular time, when you have the third one, it's called recurrent miscarriages, habitual miscarriage or abortion. So it's completely abnormal. At that stage, we need to probe further. Now, majority of miscarriages you're going to have is going to be chromosomally related. So most women that had first miscarriages will still go ahead and have all their babies. But when you have the first miscarriage, second miscarriage, third miscarriage, definitely you have to seek help from advanced fertility specialists and advanced maternal and child health specialists, so we can investigate to see what's leading to this frequency of miscarriages. Okay? For a young lady having severe menstrual cramps, will having babies earlier help? It can go any way. There are some women that prior to having babies, they used to have very bad dysmenorrhea. Then shortly after having babies, they will notice an improvement. Then there are some women that prior to having babies, their cycle is just okay. They don't really have all those severe dysmenorrhea. Then when they have their babies, they can begin to have it. So it depends on the individuals. And what can cause dysmenorrhea? Majority of them are caused by some gynecological problems. So you might have fibroid endometriosis, adenomyosis, PID, STD. So there are so many things that can lead to this. So the baseline is to go for investigations. Let's know what the problem is. Now, there are some women that prior to giving birth, they will have very excruciating dysmenorrhea. Once they start giving birth to babies, it will normalize. So it's all hormonally related. It's all individualized. So some people will feel better, some people will feel worse. Anytime in your pregnancy you notice any spotting or any bleeding is abnormal. There is no normal bleeding in pregnancy. Even the implantation bleeding is considered abnormal until we have ruled it out. So all forms of bleeding in pregnancy must be reported to your doctor immediately. The reason is because it's possible you're going through miscarriage. It's possible that pregnancy is threatened. So we need to know what we can do to abort the miscarriage, to abort an abortion. Remember that miscarriage and abortion, they are the same thing and equally. There are 3 things that once you notice in your pregnancy, you must report to your doctor immediately. Pain, water coming out of your vagina, and any form of bleeding. So if you are currently pregnant, you went to do number 1, you wiped and you saw some blood, ring your doctor, begin to go to the hospital immediately, especially in your first trimester. It's possible you're going through threatened miscarriage. Now, sometimes we might be blessed. We can do one or few things to prevent that miscarriage from happening. So it's up to you to register and attend ANC immediately. Okay? Can a woman in her 40s use her own eggs? The criteria for using your own eggs in your 40s is based on the quality of your eggs. So if we run your anti-Mullerian hormone and the indices are kind of, giving an impression that you might have good eggs, then we're going to use your eggs. But here's the deal. Once a woman gets to age 40s and she's planning to go for IVF, we always want to put donor eggs on the table. So it's based on what's unique to you. If we run all our fertility investigations and we are encouraged, if we run an anti-Mullerian hormone and it's positive, and we feel that under indices are favorable, then you can use your own eggs. Remember, we are talking about probability. There is no tone of finality. There are still some women that can become pregnant naturally in 50s. So there are still so many women that will become pregnant in the 40s. But we're talking about chances. Your chances are reduced. So when a chance is reduced, it doesn't mean you can't have that. You can have that, but it's reduced. So a woman going for IVF at age 40 can still use her own eggs. But when we check and your own eggs are not reliable and valid, don't hesitate to use donor eggs. In our practice, all our fertility specialists will always recognize and recommend donor eggs to all IVF candidates from age 40 and above. So if you're currently going for IVF and you're freaking out because you failed previously, consider using donor eggs. Consider using donor sperm. They are all available options. Okay? All right. All right, let's see. Is it common? Okay, I've already answered. CO, okay. At what age should a single woman begin thinking of preserving her eggs? In your mid-20s. The best time to preserve your eggs are in your mid-20s. The reason is because your mid-20s are when you have the best quality eggs. So if you intend, for example, if you want to be a doctor, a practicing doctor, a consulting doctor, and you're probably right now in medical school, you're in your first year, you're 22, you are already fighting against time because depending on where you live, you're going to spend the rest of your 20s in medical school. Then you're going to go for residency, you're going to go for specialty training and all that. It's going to take you a lot of time. So if you don't have relationships and you're in a particular profession or you're in a banking sector or you're in a business sector, you're booming, you don't really have time for anybody. You don't even have time for relationships. You are a candidate that should consider freezing her eggs. So the best time to freeze your eggs is actually before age 35. So if you're currently in your 30s and you know fully well that a man is not forthcoming, or the problem might be you have a very high criteria for men to even date you, then you need to freeze your eggs so you can use it later. So it's in the 20s. I love that question. Now, how will your eggs be obtained from you? Very, very clearly, well-defined process. You're not going to do it yourself. We're going to give you a couple of drugs. We're going to monitor the development of the eggs. Then we're going to carefully go, just like we are doing for IVF. We're going to carefully go into the two ovaries and extract the eggs, then freeze the eggs. So it's a professionally done thing. So we're going to give you some drugs to induce super ovulation. Then afterwards, we're going to do that. Okay, do we have any other question? You can share this video. You can see it's a very important topic, poorly attended, but very important topic that will help so many women, that will be the life for so many women. I don't want you regretting your life. I want you to be in the light. I don't want you to be in charge of your life. I want you to make your decisions based on informed choices. I want it to be you. So if you want to be a mother, be a mother. Let nobody stop you. Be your own person. Be happy. There are some women that have achieved everything in life, but the most important thing they want to achieve, they can't achieve it. Motherhood. I will personally flip the other way. I would rather you don't have anything in life, but you have your babies. Personally, I don't want you to have money, cars, houses, and all that, and people are always coming to you because of what you have. I want you to have your own baby. I want you to have someone that will call you mom. I want you to have someone that will look after when you're old. Yeah, look, I'm telling you, life is brutal. Even in your family, some people approach you because you have money. They mock you. There are some families that their mothers are mocking, their brothers, their fathers are mocking them because they have not married, or they married late, or they don't have a baby. They keep mocking you, but when they need money, they come to you. It doesn't make sense. Regardless of where you find yourself, single, married, separated, divorced, you're still the daughter of Most High God. Let nobody make you feel less than you. Love you first. So loving you first means doing what you want to do for yourself. So if you want to walk out from that relationship because it's a bad relationship, you want to go for divorce, you want to separate, you want to say no, even if it's on the eve of your wedding, do it for you. Don't say, oh, I'm married because I wanted to make my mom happy, I wanted to make my father happy. You're going to regret it. And let me tell you, you can prevent that from happening. So the same thing is applicable to having babies. Now, let me also warn you. Some of you are in relationships now, right? And you know fully well that when you make love, you become pregnant. You're not using contraceptions. Then you become pregnant. Then you start looking for a way to go and remove that baby. That will be the worst mistake you will make in your life. This is not the era of removing babies. So long as that particular sexual encounter was consensual, when a baby enters, keep your babies. There are some people that will compromise based on selfishness. You made love continuously. The probability of you becoming pregnant with just one love making is limited. But there are some people that will become pregnant for just one time. So assuming your daughter, despite everything you told her, despite the fact she needs to go to school, she continued to go and try love making with her boyfriends and all that, and she became pregnant. Don't sign any paper to go and plan to remove that baby. Let her have that baby. That might be your only granddaughter or grandson. This is not the era of going for removal. This is the era of contraception. So if you know you don't want to become pregnant and you're in a relationship, there are 13 different methods you can use. But once you have become pregnant, it is not wise to go for abortion. I don't recommend that for anybody. Becoming pregnant and having babies is now the scarcest commodities out there. Please keep your babies. That might be the only, and I'm also going to tell you this. Real men don't really care who you bring to the table. There are some divorced, there are some separated, there are some elderly women, there are some women that might be in their 20s, and you will see them hanging out, their 60s, and you see them, befriending and dating men in their 30s and 20s. The society will go out there and be talking, the ones you know and the ones you don't know. You don't know nothing about them. Everybody wants the best. So men don't come to you, or women won't come to you because of baggage you have. Gone are those days. So there are some divorced women that had 5 kids in their previous relationships, and they can still go ahead and marry a single guy that never married before. It's based on you, your own personality. Forget whatever you've had. So when you have your babies, keep your babies. Now, if you're in a relationship, you're doing boy and girlfriend, and as a girl, at the end of the day, it's the girls that will be on the receiving end. So if you're not using your contraception or you're using it wrongly and you become pregnant, keep your babies up. It's going to alter your career. It's going to alter your education. It's going to alter, your mom will call you names. They will isolate you. It's okay. Give them 2 years. They will start loving you back. So what am I trying to say in essence? Be wise. Think before your actions. Don't act before you think. If you are in any sexual relationship, pregnancy is the most likely outcome, especially if you're younger than 35. So if you know you don't want to have that baby, then use protection. Okay? So thank you so much. And I believe that's the last question I have. I appreciate you guys. So my next clinic on Saturday will be next Saturday, hopefully, right? So we'll keep you guys posted. But tomorrow, show up in our Facebook group and pages, and we'll continue the conversation. And remember, we have our last masterclass for December the 17th. We are currently getting things together. So we're going to give you guys the best. And I forgot this. Something amazing. I actually give you guys a beautiful gift. So if you're out there and you haven't downloaded the 7 secret tips of becoming pregnant fast, that's just a gift from me to you guys. So you need to go to that particular post. You need to click on the link. You need to follow the process so you can download the PDF and you can go through the steps. There are still so many people that will become pregnant in December. So that's a free gift, completely freely given to you. So go to our group, go to my personal timeline, go to our page, click on that link. Get your own copy, study your copy, then get ready for the master classes coming up much later. Okay? All right, guys. Thank you so much for coming. I'll see you guys next week. Until I see you, God bless you and bye-bye.